Santa Clarita's hometown station, AM 1220 KHTS. Make sure you go to hometownstation.com. It is the Prima Pediatrics Healthcare Hour every first Friday of the month. Talk with Dr. Feldman from Prima Pediatrics. You can go to primapediatrics.net for more information. And how are you, Dr. Feldman?
Other than this ridiculous cough that started after I got in here, I'm fine.
Yeah, so you must be allergic to something here in the studio.
That's right. I must be allergic to the radio.
Yeah, that's probably what it is. Your biking is going on.
Yes.
It's happening. Your giant race happening.
It's happening July 20th.
Is it a race?
Yes. Well, it's not really a race. It's a Bike-A-Thon. It's a marathon. A marathon with bikes. And we are traveling from San Jose to Los Angeles, 406 miles, over 6 days' time, which means
I get winded just thinking about that.
60 to 80 miles a day. And it's the Bike for Friendship. And if you wish to support me, go to Bike, B-I-K-E, the number 4, friendship.org, and go under Rochelle Feldman, and you can support me. This is a race to raise money for children with disabilities.
Fantastic.
And since it's very close to my heart, and since I love to bike, I figured, and I needed to get back in shape, I figured this is a great way to do it. Currently, I'm up to 45 miles in a day.
Oh, you're right there then.
Yeah, well, no, not quite, but I'm getting there, pretty close.
We're close.
Yeah, the 45 miles, I'm averaging right now about 15 miles an hour. So if I, the usual day they said it starts at 7 and ends at around 2. So I think that should be plenty of time for me to be able to accomplish 60 miles.
First, the Bike for Friendship, next Amgen Tour of California, right? That's
right.
Right?
No, actually, next is going to be in September. There is a Bike-A-Thon for, I think it's for kids with Down syndrome or anything. I've decided that this is going to be my thing.
That's a good thing to be.
Joining Bike-A-Thons. I would have liked to have done the Tour de Simcha. There is going to be a Tour de Los Angeles for kids with cancer, which I'm going to do. And the Tour de Simcha is one for a camp for kids with cancer in June, but it's in New York, and it would cost too much money for me to go. And I can't raise money for one.
You should just ride your bike all the way to New York.
Yeah, right.
That'll save you some money. Right?
This is my bucket list.
Okay, so we're going to talk. We're going to take a quick break, but we want to talk about medicine then and now.
Yes.
Yeah, because we can talk about how you came across this.
Absolutely.
But first, we're going to take a break. This is the Prima Pediatrics Healthcare Hour. What is it? Bikes, the number 4 friendship.org, and look for
Bike, B-I-K-E.
Oh, okay.
The number 4 friendship.org, and look for Rochelle Feldman.
And support her while she supports this wonderful cause. So we'll take a quick break, and we'll talk about medicine then and now.
Okay.
Up next on AM 1220 KHTS. Santa Clarita's hometown station, AM 1220 KHTS. Make sure you go to hometownstation.com for all the latest and greatest in the Santa Clarita Valley. It's the Prima Pediatrics Healthcare Hour. You can go to primapediatrics.net for more information, or you can give them a call, 424-9000. They're over there right on Vía Princessa across from Costco. Go check them out today. Again, primapediatrics.net. And we have Dr. Feldman once a month. We get Dr. Feldman in studio to talk all things pediatrics. And today we wanted to talk about the medicine then and now. So talk to me about, you explained this to me, but talk to me about how you came across this.
Well, it was from an email I got from my cousin Helene, and who's got a wicked sense of humor. Anyway, so what she did is she sent a little email that said, "Oh my, how times have changed, thankfully." And the subject was ads that will never run again. And I have to tell you, and she said, she says, "I can't believe that I actually remember some of these." And the truth, and what's mind-blowing is these are real ads. So anyway, so the first one shows a picture of Santa Claus with a cigarette in his fingers for lucky strikes. And then, and there are more. Then there's another one that says, "More doctors smoke Camels than any other cigarette."
That's good. That's very good.
Let me see if I can find the rest of the cigarette ads. Oh, blow in her face and she'll follow you anywhere for diplomats.
That's a little bit different. Yeah.
Yeah,
certainly.
Anyway. So, and I'm thinking to myself, yeah, I remember those. And there was one also with Ronald Reagan in it. Let me see. Oh, yeah. "I'm sending Chesterfields to all my friends. That's the merriest Christmas any smoker can have. Chesterfield mildness plus no unpleasant aftertaste, other than Alzheimer's, of course. Anyway, so I was thinking about that, and I'm thinking, yeah, that is true. These are very interesting. And of course, when I was growing up, yeah, my mom and dad smoked. Everybody smoked. Nobody thought twice about it. I remember my brother having a fit when my father would go to tie his ties. He didn't want him to tie his ties because he would sit there. He would hold the cigarette in his mouth, and it would burn and burn, and he was afraid the ashes would fall off and burn his leg.
Oh, my gosh.
I mean, everybody smoked. And then
It was a part of life, certainly.
Yeah, it was like, everybody did it. Although I could never understand why grown-ups would do it. It didn't make any sense to me. And my brother was asthmatic, by the way. As a matter of fact, so did we all turn out to be asthmatic. But in addition to that, but we started finding out in the 1960s that cigarette smoking wasn't such a good thing. And now, of course, hardly anybody smokes, or those that do smoke know what they're doing.
They know what they're
very
getting themselves
unhealthy.
into, certainly.
Yeah. But still, there are still a whole load of teenage kids who start smoking. And I really have a hard time understanding why. I never understood it as a kid or as a teenager or as an adult. I've never gotten it. I never understood it. But it is a phenomenon, and it's still occurring. Lo, these many years later, now that we know it absolutely causes cancer and heart disease. We know this. We know this with 100% certainty now. And yet people still smoke. Now, I can understand adults who've been smoking for 40 years, why it's very difficult to stop. And in fact, by the way, my father stopped smoking when he was 60 because he had a pulmonary embolus. And he said, that's it, I'm done. And he never picked up another cigarette.
Wow. Smoking for 40 years, you said, and then just cold turkey?
Yeah, he quit cold turkey because he had that
impressive.
pulmonary embolus. It was very painful. And he looked at that and he said, I'm done. My mother, it took till the day before she had her heart attack at age 78.
Oh, my goodness.
The morning before, she picked up her cigarette to smoke. Her usual thing was in the morning, she'd get up and have a cup of coffee and have a cigarette, And she looked at the cigarette and she said, why am I doing this? And put it down. It must have been a pre-warning because the next day she had a heart attack.
Wow.
No, she didn't die from it, thank God. And she did get recuperation. She went on to live another 10 years, and she would never have done so if she'd continued to smoke.
Wow, that's...
So, smoking clearly is not good, and yet teenagers still do it. I think partly it's because teenagers, first of all, don't have a lot of prefrontal cortex yet. That's the area in your brain that's just above your eyes and on the bottom of your brain. And it's the area that is involved in executive function. It's the area that says, no, you shouldn't do that. It's not a good idea. Well, they don't have a lot of that. It's not very well developed. And so
Really? Teenagers, huh?
Right. And so impulse control isn't really a big deal with them. They don't have a lot of it. They don't have the kind of control that, older adults do. Because in men, it doesn't really fully develop till mid-20s. In young women, it develops more commonly late teens, early 20s. But there's variation in both. So that's part of the reason. And the other part of the reason, I think, is because teenagers think they're immortal.
Yeah.
They just don't think anything's going to kill them.
I remember when I was a teenager, I used to just jump off of stuff. I just jump off of stuff,
Yeah.
Why not?
Because you didn't think anything was really going to hurt you.
Nope.
And you didn't think anything was really going to kill you either.
Yeah.
So, that's part of it. But I think some of it now is still that it's still enticing. And because there are still... I'm not sure how they're doing the ads for cigarettes now. They're not doing any ads, period.
You can't do them on TV, and I'm close to positive you can't do them on radio.
You can't do them on radio or TV. And ads even in publications are very restricted.
Yep.
But still, the message comes across that smoking is cool. And smoking is anything but cool.
Well, I think it has to do with the way I think tobacco companies get it done is the quote unquote cool people on TV are smoking cigarettes, like or in movies, TV and movies, because you got shows like Mad Men and stuff talking about
Right.
the 1960s.
Yeah, from the 60s,
stuff
and they
like
show
that.
them smoking because it is time appropriate.
Yeah.
But the problem is it's not appropriate because teenagers watch that.
Yeah.
And that's an issue that needs to be discussed as a public health issue.
Yeah.
So that was the first thing that came up. Now here comes the next ad.
Yeah.
This is the best. I just love these because it's just so real. The next one, you'll love this one, and I had forgotten it, but I've actually seen those myself. And this one's for a better start in life. Start cola earlier. And it's from the Soda Pop Board of America, and it shows a baby. Not soon enough. Laboratory tests over the last few years have proved that babies who start drinking soda during their early formative years have a much higher chance of gaining acceptance and fitting in during those awkward preteen and teen years.
Wow. That's awesome.
So do yourself a favor, do your child a favor, start them on a strict regimen of sodas and other sugary, sweet, carbonated beverages right now for a lifetime of guaranteed happiness.
Wow. That's pretty impressive. I kind of want a Coca-Cola now. That's the thing. Okay, so we'll talk about that. We're going to talk about that and how it relates to, because, it says doctors recommend this stuff, and all that stuff. So we're going to talk about that and, medicine then and now on the Prima Pediatrics Healthcare Hour on AM 1220 KHTS.